Hello everyone. Today I'd like to talk about high blood pressure medications. We'll be looking at three drugs you've probably heard of from your pharmacist: Amlodipine, Losartan, and Lisinopril. You might even be taking one or maybe even two of these right now. Don't worry, we're keeping it light. Instead of scary medical jargon, I'll explain how these medications actually work in your body in plain, simple terms. Understanding your medications isn't just helpful, it can be a truly essential part of protecting your health. First, let's look at the big picture. As many of you probably know, high blood pressure, or medically termed hypertension, is one of the most common conditions among adults aged 60 and older. For decades, the medical community has worked to find the absolute best way to manage high blood pressure, especially in older adults. Just as metal rusts over time, an aging body responds differently than a younger one. This is by no means a simple issue. It is a topic that has been studied through some of the largest and most rigorous clinical trials in medical history. One of the most critical studies in this field is the ALL-HAT trial, which stands for the antihypertensive and lipid-lowering treatment to prevent heart attack trial. Involving over 40,000 participants, this massive study directly compared various blood pressure lowering drugs, including amlodipine and lisinopril, to see which was most effective at reducing heart attacks, strokes, and mortality in real-world patients. Published in the Journal of the American Medical Association, this study fundamentally changed how doctors prescribe blood pressure medication to this day. But ALL-HAT isn't the only landmark study that shapes how your doctor thinks about your treatment. There's also the SPRINT trial, the Systolic Blood Pressure Intervention trial, published in the New England Journal of Medicine. This one asked a slightly different question. If doctors treat blood pressure more aggressively, aiming for a lower target number than was traditionally used, do older adults actually come out ahead? The answer turned out to be yes for many people. Intensive control meaningfully reduced cardiovascular events and even lowered the risk of death from any cause. That said, it also came with a higher chance of side effects like lightheadedness from blood pressure dropping too low and some changes in kidney function markers, which is exactly why your personal target number should be worked out with your own doctor rather than something you adjust on your own. And then there's the HYVET trial, the hypertension in the very elderly trial, also published in the New England Journal of Medicine. This one is especially relevant if you or someone you love is in your 80s or beyond, because it specifically studied adults 80 years and older. For a long time, some doctors worried that treating blood pressure aggressively in very advanced age might do more harm than good, since very old bodies can be more fragile. HYVET helped answer that question directly. Treating hypertension in this age group reduced the risk of stroke and reduced overall mortality without the harm some had feared. So, with proper monitoring, blood pressure treatment continues to protect the heart and brain well into your 80s and beyond. Now, let's dive into how these three medications actually work inside your body. Understanding how they work makes it a lot easier to understand their side effects too. First, amlodipine. It belongs to a family of drugs called calcium channel blockers. Don't let the scary name intimidate you. Simply put, the muscle cells around your blood vessels need calcium to squeeze tight. Amlodipine gently blocks calcium from getting into those cells, which lets your blood vessels relax and widen. Picture a garden hose. When the hose widens, the water flows through with much less pressure. That's pretty much how amlodipine does its job. Losartan and lisinopril, on the other hand, take a different approach. They both target your body's built-in blood pressure regulation system called the RAS system, short for the renin-angiotensin-aldosterone system. Your kidneys release renin, which starts a chain reaction that produces a hormone called angiotensin II. This hormone is a powerful vessel tightener. Here's the difference. Lisinopril is an ACE inhibitor, meaning it blocks the enzyme that makes angiotensin II in the first place. Losartan is an ARB, an angiotensin receptor blocker. It lets the hormone be made but stops it from locking onto its receptors so it can't tighten your blood vessels. Even though they take different routes, both end up relaxing your blood vessels and lowering your blood pressure. Now let's move on to the real world side of things, the practical details you might not know about these meds. First up is amlodipine. Its most common side effect, especially for seniors, is swollen ankles and calves. This isn't like heart disease where your body holds onto salt and water. It's simply because the drug relaxes your blood vessels, causing fluid to pool. It can be annoying and uncomfortable, but it's usually not dangerous. Elevating your legs in the evening and wearing supportive stockings during the day can sometimes help make it more manageable, though it's always worth mentioning to your doctor if it becomes bothersome. Here's a cool little detail most people don't know. Amlodipine is broken down in your liver by a specific enzyme, and grapefruit can actually block that enzyme. So if you love eating grapefruit or drinking grapefruit juice, check in with your pharmacist because it can mess with how active the drug is in your system, potentially making its effects stronger than intended. Next, Losartan and Lisinopril. People mix these two up all the time, but there's a big difference a lot of seniors don't know about. Because Lisinopril is an AC inhibitor, it causes a substance called bradykinin to build up in your airways, causing irritation. That's why Lisinopril can trigger that classic annoying dry cough. Sometimes this cough doesn't even start until months after you take your first pill, so a lot of people don't make the connection. Losartan takes a different route, so it usually doesn't cause that cough, which is exactly why doctors often switch people from Lisinopril to Losartan. Here's a super important point that a lot of people mix up. Many seniors assume blood pressure meds work like water pills and flush out potassium, but Losartan and Lisinopril actually do the opposite. They tend to bump up your potassium levels. This comes down to how they affect a hormone called aldosterone. So if you're taking potassium supplements, eating a high potassium diet, or taking other meds that boost potassium, you could end up with hyperkalemia, meaning too much potassium, which can mess with your heart rhythm. That's the exact reason your doctor orders routine blood work while you're on these drugs. It's not just a formality, it's a key step to keep you safe. Another thing that catches people off guard is that over-the-counter painkillers like ibuprofen, which belong to a category called NSAIDs, can actually dull the effects of both calcium channel blockers and RAAS inhibitors while putting extra stress on your kidneys. This is especially risky when paired with lisinopril or losartan. So if you're reaching for ibuprofen all the time for joint pain, definitely talk to your doctor. Acetaminophen might be a much gentler alternative for you, though of course that's also a conversation to have with your pharmacist, since everyone's situation is different. It's also worth mentioning dizziness, particularly when standing up quickly from sitting or lying down. All three of these medications lower blood pressure, and older adults can sometimes be more sensitive to sudden drops when changing position, a phenomenon doctors call orthostatic hypotension. A simple habit that helps is pausing for a moment after standing up, especially first thing in the morning before you start walking. If you ever feel persistently lightheaded, that's worth reporting to your doctor rather than just working around it. Home blood pressure monitoring is another tool many seniors find genuinely empowering. Keeping a simple log of your morning and evening readings gives your doctor real data to work with at your appointments, rather than just a single snapshot taken in a stressful clinic setting. Many pharmacies and community centers also offer free blood pressure checks if you don't have a home monitor. Finally, I want to talk about something you don't hear much about in the news, but it's super important. Even if you feel amazing and think your blood pressure is totally back to normal, never stop taking your meds out of nowhere. Quitting cold turkey can cause your blood pressure to spike dangerously high. Any change to your prescription should always be done with your doctor, along with keeping an eye on your blood pressure and getting routine blood work for your kidneys and potassium levels. If you're taking an ACE inhibitor or ARB, here's the main takeaway. These three drugs, Amlodipine, Losartan, and Lisinopril, are backed by decades of solid scientific research from trials like ALL-HAT, SPRINT, and HIVET. They've saved countless lives by shielding the heart and brain from the long-term damage of high blood pressure. But knowledge really is power. Understanding what's going on in your own body, telling a minor side effect apart from a major red flag, and being proactive about your health is how you get the absolute best out of modern medicine. Remember, leaving high blood pressure unchecked can snowball into even bigger health problems down the road. So please make sure to talk to your doctor. As always, nothing you hear on this channel should ever replace an actual consultation with a doctor or pharmacist who knows your full medical history and can guide you safely. Stay curious, stay engaged, and I'll see you next time. Wishing everyone good health. Also, please don't forget to like and subscribe to Golden Senior Cafe.